That's where all the forms and other things that John may have you fill out or things that you need to keep up to date can be found. Maybe. There they are. Okay, so you'll notice there are a couple different headings or folders, and then inside of those folders, other folders, and I'm sure inside of those folders there might be some other folders. And it's like those Chinese stacking dolls. There's just folders on folders on folders. And anything that you would need inside of Adjunct faculty can be found inside of there. And again, if you have trouble accessing those things, you can either contact John or myself, and I'm sure we can figure that out for you. Trying to think what else. Epigeum.
Yes.
Epigeum. Okay. Last one. I would love to put this information inside of the Adjunct faculty page so that you don't have to go to both places, but right now it's not there. So I'm going to show you where it is, but hopefully this same thing will be inside of this page by the end of the week as well, so that you can concentrate on just staying in one place. Because I know you're getting a ridiculous amount of information. It's the end of the day. Kind of look like some of my fourth graders would when I'm trying to tell them how to simplify fractions. Let's just get over it, right? Give me the answer. Okay, let's go. All right. So here, my Epigeum information is going to be inside of my housing station, which is the instructional technology page. And the Epigeum software, like John said, is kind of like pieces that you can pull to make your own, or you can use the whole thing. But like you said, it's what, 40 hours? Yeah, let's pull our own pieces. That sounds a lot better. Your Epigeum announcement is over here. It's sticky, which means it's not going anywhere. Okay, that'll be up there all the time. If for some reason you're using some kind of textbook or some kind of information inside of your class, and the publisher says, hey, we have this information, we have these modules, we have these quizzes, you can use those. I want to use those. We can put those things inside of Campus Cruiser so that you and your students can use those. Okay, it might take a little bit of noodling, and we might have to change the file format and wait for Campus Cruiser to do their job on the other end, but hopefully we can get those things inside of there so that if there's modules, there's chapters, there's quizzes, there are assessments, there's things that you can use, those things can be found inside of there as well. Here is my Epigeum publication, and this is just a, oh geez, a lot of people using Cruiser. This is just, excuse me, the message board announcement. So the only thing you get here is the information. The actual download would be found in the download link. And notice that your username and password are here as well. Because it's something that's copyrighted, it's protected. Now it's copyrighted and people at Winder can use it. So everyone can use this same username and password to look at that content. Again, I'm not going to show you how to go through all of this because I did that in a video, and I will show you how to get that video right now. So that if you would like to look at this information and you want to play around in there a little bit, you're able to do that. It can be found here, right here on our YouTube page. This is our University Nursing YouTube page. So when John says, hey, I need my adjunct faculty to be able to do this, or Rose Schwartz, who I'm sure you met earlier, said, hey, I want my faculty to be able to do this in gradebook. Or can you tell them how to do this? Anything that they get, hey, we need a little bit more help, I try to make a video for, and they all go in the same place. So the forwarding of the email, the importing of grades, the putting the different publications in Campus Cruiser, all of those videos are up there. If for some reason it still doesn't make sense to you, again, I'm going to give you my business card today, and you can get a hold of me that way. But you'll notice that when I click on my YouTube page, this is the building you're sitting in. It's a good way to know that you're on the correct page. Okay, this is Founders Hall right in front of you. And again, here are our videos. So for example, our room mail forwarding, our looking at class reports. Here's our Epigeum publication that we were just talking about uploading. How do we make classes or hold classes so that we can mess around in Campus Cruiser a little bit? All those things that you might need a little bit more of help with can be found inside of those videos. Now that's just my resources. If you're on Campus Cruiser and you click up here at this little question mark, all of Campus Cruiser support stuff is in there as well. So know that the things that you get off of Winer's page are just going to be my lovely voice behind it. And those are the only things that people told me they needed a little bit more assistance with. All the other basic stuff of naming a class or setting up an assignment or some stuff that we might have overlooked because we do it all the time can be found in that support section up there at the top of Campus Cruiser as well. I went a little bit over my time, so I'm going to rush out of here so Brenda doesn't give me any dirty looks. Are there any questions,
I was just rolling with it.
concerns, or comments that maybe I can help you with right now?
These links are going to be sent out as well.
Yes.
So you'll have a link that'll just get sent to your email, and you'll be able to say, oh, Adjunct faculty may be able to go
Yes,
forward.
in that email, you will get a link to the video, which is everything we're doing right now. Everyone wave, you're gonna be on video, okay? You'll get a video. You'll get a link to the YouTube page so that you can find all the videos that we just talked about, as well as some other information that we find permanent that you would need in order to get a hold of us if that's the case. All right? Okay.
All right, everyone.
I'm just gonna leave my yellow papers and business cards up front. And pick them up or pass them out, whatever works for you.
Thank you.
Absolutely.
Thanks, Andrew.
No problem.
All right, so our piece de resistance.
Oh, yeah.
So this is Dr. Concerta. This is Brenda Concerta. She is our full-time faculty member for psychology and also for our leadership. So I made this before that I do. So she's going to talk with us today on a topic that we end up seeing a lot within the clinical. Guys, we'll end up having these come across the way. Oh, you know.
Okay, so I'm not sure that I can really sustain that level of excitement that Andrew had. I'll do my best. On my best kind of low key. So thanks for everybody for coming, and I know this is like the end of the day, so I'm going to blow through this really quickly. I would love to have given you a little more engaging presentation, maybe some other time. But basically, one of the things that we thought about is psych, and it's sort of near and dear to me because psych moved from the junior year to the senior year. And I kind of hear from my seniors like that they don't even remember therapeutic communication ever being addressed. So this is kind of my plea to those of you who are teaching the junior year, bring it back, remind them. So we're just looking at like ways that you can integrate some of this stuff in a clinical setting. And I think you all know what those psychosocial things are that we see, and truly, you see them no matter where you are. They're not specific to psych abuse, behavioral interventions. Who's teaching in med-surg? Okay, so you guys are in the acute care setting this semester in med-surg. How many of you guys see patients with psych issues? All the time. Yeah, I think sometimes they see like more psych issues on med-surg than in psych. All right, so you're seeing all this stuff. So the idea is to just remind people, because I think what happens is our students tend to compartmentalize things, and they think psych only happens in psych, but it really happens everywhere else. So just to think about as you're going through, like, hit some of these things. If you have a patient that's got something going on, family issues, grief and loss, stress management we could all benefit from. And for me, therapeutic communication is a big one that it's almost like they've never heard it when they get to that senior year. So some of the common problems you might see in your settings, other than the psych settings, is, you know, issues about managing illness. And the other thing that we noticed when we got our NCLEX report was that the one area that we really need to sort of tone up a little bit and tune up is looking at health promotion and maintenance. So I'm trying to wrap some of that in here. So, you know, in that discharge planning, how many people have students do discharge planning or help with discharge? So if you have that opportunity, and sometimes it doesn't happen or just kind of falls off our radar, because I think students hit that clinical setting and they just want to see blood, guts, and doing all those high-tech procedures, and they forget, like, you know, talking to patients and doing that stuff. So just, you know, if you have the opportunity, get them to hone in on it. Some of the ways that we can do that is really to get them to talk about these key issues, and certainly when we have patients in the hospital for any kind of surgical procedure, they've just been diagnosed with, cardiac issues, diabetes, that's gonna require a lifestyle change. It shifts them in a lot of ways in terms of self-esteem, body image, all these kind of things. So these are just some things that you could think about when you're working with your students. What's their response? So what are some things you might do is, talk about that difficult patient. Who teaches in the fall semester med-surg? Anybody teach med-surg? Do you guys have like a lot of behavioral issues with patients, the difficult patients? Yeah?
Long-term care.
Long-term care? Yeah. Yeah, and sometimes it's the staff that's more anxious than the patient. So we talk about, and I used to do the mental health integration piece where I'd meet with them that first day and talk about what's going on, and it was usually the staff was more anxious and behavioral issues than the patients. But, just working with them so that when they get to psych, when they get to that senior year, they kind of have a good sort of set of tools in terms of dealing with behavioral issues, anxiety, and all those things. Because the idea is we're teaching a concept-based curriculum, so the idea is that they have those concepts, and we're just building on further in that senior year so that they have a little bit of that foundational stuff. In the junior year, they should be talking about anxiety, depression, any of those kind of things that are going on. So certainly, also self-care. We do a lot with self-care and really encourage students to think about, what are they doing for self-care, asking them about interdisciplinary teamwork. And how do you do this in the clinical setting is to really sort of capitalize on the time you have with them. That downtime, pull them aside, ask them what's going on, ask them are there any, psychosocial things going on, communication with them and team members, communication with them and patients, watching what's going on in the unit, starting that prioritization conversation early. Sometimes what happens is they don't hear it till leadership, and I ask them, like, what do you see and what do you remember from med-surg, and they don't remember, but they see it, right? I mean, I know you guys know that they see it, but somehow in their mind, they sort of get that first year, that junior year, and they're really focused on doing procedures. And do you remember that? It wasn't that long ago, right, Jerry?
No, it wasn't.
Do you remember that shift? Because I think that happens, and then they get the leadership, and they're like, oh my God, what's delegation? And it should be so I'm hoping that if you guys put it on the radar, and a lot of you guys are going to be teaching in the senior year, so it will be on the radar. But for those of you who aren't teaching in the senior year, if you could start putting that prioritization conversation like in their head early on. Because it would be wonderful if they would do that, because I think they miss a lot of opportunities to look at that. And help them recognize safety issues and stepping back and looking at the big picture. Like, here's an example of a safety issue that blew my mind. We had a student who was at a facility, I won't say where, this past semester in a psych rotation. She was talking to a patient, and I give the talk about if you're working with a patient and they start to really like get under your skin, something just skeeves you, something's not right, if they're crossing boundaries, just step away, excuse yourself. Well, the student thought it was not therapeutic, so she let this patient like go on and on talking about sexual, like really inappropriate stuff, and asking all kinds of personal questions, and got all this personal information, and then the guy ended up getting discharged, but he had said like, I'm gonna come visit you at Widener. I'm gonna come visit you at Widener, and I think like maybe we could go on a killing spree. Surprise, surprise, one of his diagnoses was antisocial. But anyhow, so he had this like, and I think he did some of it just to like get a rise out of her. So anyhow, so he gets discharged, and lo and behold, he does have some criminal charges, and he ends up going to GW Hill. So he goes right from there to GW Hill, so I'm like, okay, this is good. But when I talked to the student, I said, like, what happened? How come she didn't, like, cut that conversation short? Well, I didn't think it'd be therapeutic. I thought I might get in trouble. This is the mindset. And then the other thing is the guy shows up. So the guy shows up here just last week. It just occurred. So the guy gets out of GW Hill. He shows up here at Widener, and she recognizes him. Instead of like bolting to security, what do you think she did? Bingo. She says hi, and then we get into this conversation. And he's looking for students to come work for, like this crazy conversation, but engaged him in a conversation for quite some time. So in terms of like not seeing the big picture, And then I said, like, what's going on? Like, why didn't you do something? Why didn't you put, and she was all worried about like HIPAA and all these other things, because she never came to report it the first semester. It was her and another student. So the other student reported it. She never talked about this conversation until she saw the guy show up at Widener, and she realized like, oh, this guy's really serious. So anyhow, and then I said to her, well, are you gonna talk to the police about this? Well, I really don't wanna get like him like retaliating. I don't want him to think about revenge. I'm like, this is a safety issue. So it's those kind of things, the big picture they fail to see. So in her mind, the big issue was HIPAA, not like that this guy, has a PFA, has been in jail because he's violent, and he could possibly hurt me or somebody else. It was HIPAA. So like, the critical thinking piece is still working. So I'm hoping that if we start earlier, I kind of digress, but it just made me think about that, and it just blew my mind that her biggest concern was HIPAA. So meanwhile, I called the hospital because I knew the guy's name, but not his last name, because nobody knew what his name was. They didn't know his last name, and we wanted to get some information to report it. So I called the hospital and I said, this is kind of a crazy conversation. I said, but I had students that were there, and there was a patient. I tell them the story. I say, can you tell me that man's last name? So the person goes, oh yeah, hold on, let me look it up. I said, well, he was discharged on 9/24. Oh, okay, well hold on. Do you need his date of birth? I was
From one end to the other, right?
From one
One
end to the
extreme to the
other.
other.
But again, like that piece of like HIPAA, like when safety's an issue, like they sort of get these concrete things. So in clinical, if you could kind of get them to step out and look at that big picture. So in terms of working with psychosocial issues, just getting them to do, we used to do a psychosocial assessment. Do they do that in Med-Surg 1 anymore? Who does Med-Surg 1? You guys don't do the psychosocial assessment? We used to have them do a psychosocial assessment, which was really helpful because they started looking at those psychosocial issues. And these were just some of the questions, getting to know the patient, other than just the treatment I'm doing, but who is that patient? What's the impact their illness is having on them? What are their stressors? So we start hitting those psychosocial things. In the interest of time, I'm just gonna kind of blow through a little bit here. So if you are teaching and you'd like to do a psychosocial assessment, I would really encourage you to do that. In terms of care plans, when you're working, and I'm telling the coordinators for the courses too, that we really should get back to it. One time we had people have like one medical diagnosis and one psychosocial diagnosis to kind of keep it ever present, because everybody's got, I think you'd be hard pressed to find one patient that didn't have some psychosocial issue as a result of being in the hospital. So just to get them thinking about it. In terms of psych medications, because lots of people are on psych meds on Med-Surg units. Start putting that on their radar, because there's so much for them to learn, and they get kind of overwhelmed by the time they hit me in psych. So I guess I'm kind of putting a plug in if you could put that psych stuff kind of in their mind, because it's not just a psych patient and a medical patient, it's the same patient that's complex, so getting them to look like that. Anxiolytics, we've got tons of patients on anxiolytics. So again, the big buzz out there in care, in primary care, is integrative care. So, in the nursing school, I hope we start looking at that and having them, think holistically, because that's really what we do well as nurses. That's what we can market ourselves as. Like, we see the big picture. The doctor comes in and leaves, and lots of people come in and leave, and they're specialists, but we kind of are sort of, have our hands everywhere. And then just my last plug is, again, this is in terms of thinking about NCLEX and what is it that students, and I know they're getting it, I think they just don't frame it in that way, is having them start thinking about health promotion and maintenance, discharge teaching. Where's the patient going to go? And that's usually the conversation. Discharge starts day one, but somehow it gets missed. So getting them back into that piece of thinking about that, doing screening, lifestyle choices, all those kind of things. So, and I guess like the big thing now that I see with students, and I'm not sure if you guys have been teaching for a while, if you notice like communication, shifts in communications. Anybody notice that with students? I know, it's late in the day, I know. Our students are so used to writing and texting that having a conversation really kind of unnerves them. Those of you who teach in that Med-Surg 1, when they're in those acute, and they're like, I did all my stuff, now what do? I actually have to sit with a patient, so really encourage them. some of them it's just not who they've been. I have a kid, you know, I have two kids one in high school, one in middle school, and, you know, they can text till, you know, the cows come home, but like having a conversation with somebody one-on-one, you know, especially for my one daughter, is a struggle. And what we see too is that a lot of our students have more anxiety and more depression. You know, our millennials they're in a different world. You know, they're in a world that there's all kinds of crazy stuff happening at a different level than when I was, you know, going to school. But also just that piece of that texting and not communicating. And while it's great to have all these things, I think technology is great, but what employers are telling us, our recruiters, is that students don't have those soft skills, that like engaging patients and being in conversation. So as much as you can get them in there doing that, please do so. And just a thought, is there anything people are doing that they find is really helpful in the clinical setting to engage students, to get them to do some of this psychosocial stuff? Anyone have any good strategies you use? No?
Oh, come on, we had a real nice open forum earlier. Don't set Brenda up here. I know a couple of the colleagues were saying, being able to kind of introduce them prior to going into the room, and then kind of setting them up for what you may be walking into. And then this way it wasn't like a double shock to their system, like pretty much like a pre-prep.
That's nice, that's a good idea. Yeah.
I do med-surg teaching elsewhere, and I had to laugh this semester because students come up, well, what's the etiquette for going in a patient's room? Well, the etiquette is you go in the patient's room. And you knock, you go in, you introduce yourself, and, you know, but it's, well, what if there's an intimate conversation? And I remember saying, well, they're not talking about sex. I said, but if it's a clergy person and the patient, I said, you know, there's being respectful, but I said, if the care provider's in there, you get in there and listen what care provider has to say, and you get in there and listen, but it's that hesitation to interact with patients directly. It's like, you know, and to get them past that is really a challenge.
It is. Is anybody else recognizing that more of a challenge?
Yeah, I had a problem with my students that I was at Berkeley Friends, and when the clients were going to breakfast, you know, it was me and one other student that would go up and try to help to feed the patients. The other ones just stood against the wall. And I didn't say anything at first because I didn't know how to handle that. I didn't really know how. But then when we went and had our conference, I said to them, you can't do that. You have to get involved and go up to them. Well, they're not our patient. I said, that doesn't matter. It doesn't matter. Just like if you walk by a room and there's a light on, you go in and you answer it. You don't, you know, it's not because it's not your patient. So it took a couple times, and each time more would go, you know, come in and help. To take the patients to breakfast, take them back, you know, and sit there and feed the ones that needed to be feeded. Or
It's almost kind of like that, like, I find that students are so afraid of doing the wrong thing that they do nothing. Like, and they're just like, they want to have like, to be told what to do. And I'm not sure if it's a dynamic, if it's just, you know, parents are really navigating life for students so much that they, I don't know. Yeah.
I think if you set the tone right off the bat, because I know I was at Delaware County, and there was different, when I would talk to the other students in the sim lab, they had such different experiences. Like I expected, like when I went on the clinical floor in the morning, like I told them exactly what I expected. I'm like, you are not to be sitting at the desk. You will never sit at the desk as a nurse. Very rarely will there be a seat. You know what, you're to go in and assess. You're to do, you know, to clean make sure the room looks tidy. Like that's your room for those 8 hours. Like, you know, that's, so they knew what I expected right off the bat. I'm like, you're not to be on your phone. You're not, and you're not trying to be a jerk, but like, we got more compliments because people come home like they're actually working.
Exactly.
Like you're not supposed to be standing against the wall. You're not supposed to be like in a group. That's, but then other students were like, oh, well, all we do is sit all day and like look through charts. I'm like, no. Because, I mean, most places don't even have charts anymore. So, like, and I told them that. I'm like, you want to be the nurse you want to be, you want to work with. And
Exactly, yeah.
they were all very happy when we come in. But if you don't set the tone right off on the bat,
And
it'll get away from you.
And you really have to, and sometimes you get resistance and you just gotta push through, cause I know like some students can really look like, don't even ask me a question.
Well, the same ones would come up to you and say, I'm done, my patients really don't want me in there. I'm like, you need new patients, then let's go. Or go help somebody.
Yeah, and that's
No,
what
I don't wanna
happens
see the
too,
lights
or
on.
like talk to staff.
Right.
Why'd you go into nursing? What do you, like, I say like chat
Right.
with the team. get in there, do as much as you can do, and some of it really is just kind of pushing.
Well, and I think sometimes, I know they're always amazed at me when I start conversations and all the information that the person shares with me, talk about district planning, when you get home, are you on 1 or 2 floors, is there someone at home, all that. Boy, that person, because you open up, and to try to help them to learn by example, that's how you learn about your patient.
Yeah.
Just to be devil's advocate, we obviously have some students who are going to be more shy, even though they have really good clinical skills. So I think it's important that templates are okay to use. I think it's okay as a preceptor, because this is the first time I'm going to be doing teaching here, but as a preceptor, sometimes I would come up with templates for if I was assigned a nursing student or a new nurse. And I think templates are fine until you can make the bridge to jump.
Sure.
So instead of looking at the chart and getting the history, maybe it is a template to go in and force that shy student or that student who doesn't have good communication skills to go in and grab the history directly from the patient as to that admission, rather than do the chart review for the history and then present on it.
Absolutely.
Until they can make that jump, and then they can start to see. And another thing I think is difficult is, we all know as nurses that today going to EMRs, our to-do list is based upon the checklist. We go through our checklist for our medications or our care plans that are automatically generated, whatever it might be. We're not getting credit for the psychosocial communicative aspect. We don't get a check mark for that. So that is the thing that gets dropped off the most. It's probably the most important, but it gets dropped off. So again, I think having that template, because I think the students already foresee, like, I don't have to do this stuff down the road when I become a real nurse, because that's not what my end of task is going to be. And I think it's important to reinforce it as early as possible.
I think that one of the things is to have the student get rapport with the nurse.
Absolutely.
I think that's good, because that breaks, then they get used to getting report, because they're going to actually get report. So when the nurse goes in to introduce herself, or that she's the nurse for this here, and him or her for this shift, then the student can get more comfortable in that way.
Exactly.
Or like go with them. You know what I mean? Like some students, like, instead of sitting and waiting for the nurse, then you go with them. And then you can see them out there, how they present themselves and how they mount themselves.
Yeah. And, hopefully we're seeing that, but really just to encourage them to push out of their comfort zone a little bit. And again, get to know the patient, hear the story. Like in psych, I think, many, and I know there's some psych people here, I remember being told, like, you can't look at the chart, you need to just go in and see the patient, and you get a whole different story if you don't come in with that bias, but sometimes it's important. So again, I actually tell students, do what you feel comfortable with, because I try and meet the resistance a little bit, because like you're saying, if you're that anxious and I'm pushing you and you're so anxious you can't hear anything, so it's kind of a back and forth, but each time you can, push them out a little more and get them to that critical thinking piece. And just because you're not in leadership doesn't mean you can't understand about prioritization, delegation, how's the team working together, because the more they recognize that, by the time they hit leadership, they're like, oh my God, yeah, it makes sense. People get to leadership and they think it's all about management, and I don't want to be a nurse manager, why do I have this course, which is completely not what the course is about. So anyhow, so that's just my thoughts. So just to encourage you to, get them to keep thinking about that psychosocial stuff too, because I think that gets neglected, and then those are the patients that are anxious, acting out and doing all kinds of other things that maybe not fully listening to the teaching we're trying to give them, because we haven't listened to their story a little bit. So that's very, very brief.
Thank you.
So I guess we're supposed to meet with clinical people.
Yeah, all right, guys.
So,
See you later.
So now what we're gonna do is our course coordinators will come down and touch base with the groups individually. It may be feasible and just help facilitate things if we just kind of get groups. This way the course coordinators can just kind of come through. So why don't we, how many psych people, how many med-surg people? Who's what, where? Psych? All right, so there you go, you got your hand up first. So why don't we do the psych people over here? OB, you
actually,
guys.
psych and leadership.
Oh yeah, there you go, do psych and leadership together. So why don't we do psych and leadership up here. Obstetrics, you guys have already met, right? You guys have all right? You guys are all situated, so you guys are golden. So you guys are there. Because it's just to meet just with the course coordinator. Every patient.
Good day.
Here's my Oh, okay, because you're with me and Brenda. You know what, we can go to another. Are you sitting in here, Brenda? Yeah. Okay. We'll go right next door. I want to go right next door.
We actually have, Mary, I have 305 that next door, available as well, if you guys needed another room.
Yeah, I'm gonna be.
Right next door, I did reserve that, too, 205, whatever works for you. Thank you so much. Yeah, guys, please leave your emails for me if you don't mind. You got it. Follow Mike.
I'm okay. First time I did them. They're kind of, you know, I was kind of like, I guess I better answer this.
I was there when they were talking about doing it.
I was going to do one. I said, okay. I said, well, I wasn't told. I read Einstein's
Getting married in March, and I got a truck. So like, not so many hats I could do, but like I live. Obviously, you know, our truck is like right that 7 bridge, and I read all the other trucks. So like, right outside of Richmond, it's so Hartford, that's where I live. Yeah, right there. That's right. My dog lives there. That's right. So like,
Their computer training and anything.
so like, no.
So that we
Where is this?
No, this is coming from me.
And we go through clinical, and what I'll do is I'm gonna email you all the documents. We have sustainability, they don't always make a million copies of things, so I'm gonna send you everything else and talk about stuff. Students are still being put into. All right, so clinical starts week for them, but any training, orientation at their facility, if Einstein makes them do training, Carolyn.
I'll find out on the 22nd. I gotta go to the 22nd to meet you guys for,
So we can't figure out what's wrong with
for orientation. My orientation is just gonna be about 2 hours. And then you'll let me know what I need to do.
And then they need to do that week of the 19th. When they come back to school, they don't have clinical, so that's dedicated for them to do anything they need to do to get into the facility. So for everybody, on-site clinical, except for psych, actually, let me hear why you're doing the, interview.
legitimately So I work at Turner's
But
Bridge,
everybody
so
else
I
will
would say
start
that
that
they
week.
took maternity leave and
Sunday
all this other
folks
stuff,
start
so
clinical
they
on the
needed a lot of
24th.
coverage recently and.
So that's Jill. Who else is
down on the
assigned
floor one
that?
day 'cause
Okay.
you're not in ICU,
Kathy.
people down.
County
Montana.
PPC?
Correct, PPMC.
Oh,
Okay.
yeah.
24th is
Twenty-
the first date that we're actually there, but we're gonna meet with them sometime this week to get everything done.
Right,
We're
that wanna like be in contact with them, they're not in campus cruiser yet, I have lists, but the students might change them, but I can give you,
So then they go down to the hall, and then it's
their names.
Okay,
I need to reach out. What I'll do is I'll send, you know, what I'll send you this.
They go through regular nursing, education to be onboarded, or?
They have to do whatever the stuff is, and who did PPMC? Anybody?
10th grade.
Yeah, you did,
Yeah.
yeah.
They have to do an EMR, it's the
Yeah.
computer training.
Yep.
So they go in for 4 hours for that, and then you'll send together kids.
Mhm.
Takes a long time.
Yeah, I know.
Yeah, so.
And Trisha Grandy, I think, is helping to try and set some of that up, so if you haven't
Well, I
met
work there,
Trisha.
so I can find out who in nursing ed. I think it's, Bird, okay. And maybe Mary Ann Jones, I think, plays all the students. So I'll let her know that I'm one of the instructors, and then she'll help
To
me
get
out.
them in for computer training.
Gotcha, all right. I'll contact her tomorrow.
That's great, you know the place already.
Yeah, I am lucky
So
about
you
that,
guys
yeah,
will
you're
be
right.
attending. Katie's gonna have to have her kids do it. Who else is my PPM?
Are you in for
That
it?
would be really
Just us.
Oh, I
Leadership, it's a little easier. Just go up and
He
introduce
told us
them.
to send you.
Yeah, I'm not here.
Did you get
It's hard for you, and so they have to know the computer system.
Yes.
Work with the room to get the people.
So, yeah, the head site as well,
No.
and you are.
Yeah.
I'm Katie, Kathleen.
Okay, so one of the things, so anyhow, so clinical, and the other thing for clinical that we butt up against is spring break. For everybody.
Where are
So
we going?
For everybody.
Do we get to go somewhere?
So the week of spring break starts for us on March sixth, however, Sunday clinicals, actually, they will be going on the 13th. Spring break goes really from Friday, from Saturday the 5th through Sunday the 13th, but because students who are on weekends need to get clinical, they have to be there. So Saturday kids are gonna be there on the 5th for spring break, but will not be there on the 12th of your Saturday clinical. So for Saturday, and Sunday folks will not be there on the 6th of March, but you will be there on the 13th. Clinical finishes up for us, you know, barring any kind of crazy weather, the week of April 4th. The week of April 10th is set aside for makeup day if we have to do it. Fingers crossed we won't.
Sunday people finished here or finished on the
They're
10th?
finished here.
They're finished on the 3rd,
Finished on the
but they
3rd.
have the
Clinical
10th if they
week
have to
10.
make it up.
Correct. So that week of the 10th, straight across, Sunday through Saturday, is makeup for anybody that needs it. Okay. Psych simulation, Carolyn, is gonna be on April 26th.
26th.
The 26th, and the other day
Oh, okay.
is,
Michael Murphy.
is February
Doing Saturday.
23rd. Is my other simulation. The 23rd, it sounds like Dawn doesn't want people coming in. I'll double check with her.
Oh, by Michael, right. Oh, yeah.
Leadership does simulation too. I don't have it scheduled, but Dawn will put a schedule together. When your group is here for leadership, you should come with us. So as soon as I get
So you can have like your own table in the room and shut the door. Nobody in there. But
So here's a little letter. I have my cell phone number on there. I should have put my home number on too for the public weekends. If you have to call me about anything, you can call me about any question, like there's a problem, let me know. Last year, we had a student who.
not a problem.
My syllabus wasn't tight enough, you know, not following the code of ethics, which to me is an issue, but it didn't specifically say what that meant. So now what I have in my syllabus is, okay, if any student is dismissed from a clinical site because they are unsafe or unprofessional, they have failed clinical. I don't care what it is. Clinical site has asked you to leave, it's a problem. We had a student in a high-risk place, and she fell asleep over to me in a NICU. to me. You should have been, yeah. Fell asleep in a NICU, sitting down, holding a baby, after being told, go wake up before that. To me, I was really pissed, so now it's clear in my syllabus, if you do something like that, that's it. I don't want you to be in my notes. So anyhow, that student ended up with a number of people on a different site. So please, really let me know, if students are late, because that repeated stuff is gonna get them if they go to the job like that. So they need to make up late time. We'll do a behavioral plan. We had somebody that was late a bunch of times, that we had a couple will come to Jesus meetings with 2 students that just sort of showed up when they showed up, they were weekend students.
We won't be here.
Yeah, whatever. So really have that conversation with them, they should figure it out, if you had a job, you figure out how to get to the job, how long it took them, where you came. So that conversation should really be one, that is had with them, and I will say to them when I have conversations. So I'm gonna get them together that week of January 19th, just to go over paperwork with them. Computer access, again, they have to figure that out. Tricia Grandy in our main office is your contact person, your point person for all that information. She'll be sending you information if you have to do stuff. If you haven't heard from her, please, email her, let her know. Preceptor mentor expectations, I'm gonna give you a document, and unfortunately, it was all crazy. I had it up on the computer and the was doing something wacky. But I'll send that to you. Basically, out of some concerns out of UConn, there was some concern about clear communication. So I tweaked the paperwork a little bit, and this actually sign-in sheet is something that they need to be doing now. There was some concern about how do preceptors know when you get a different preceptor sometimes, from week to week, how do they know what your skill set is? So the intent is that they keep a log, and I'll send you that paperwork too. It's gonna be a reflective journal, but it's also gonna be who are the patients you care for, what was their diagnosis, what meds, with a little bit of what they did, so they can bring that to the preceptor and say, this is what I've been doing, and these are my learning needs. They're supposed to be setting goals every day, what's your goal for the day, and long-term goals. They also write an introductory letter that they give to you, to the nurse educator, to the nurse manager, to the preceptor, and you. And I will talk them through that. And I think when I send you all these documents, it'll make a little more sense. Information over. But anyhow, what they need to do is they need to review in the morning with their preceptor, get it signed off, and at the end, they should report off at the end. When you go around to check on students, you can sign off. Just make sure they're doing what they should be doing. Yeah, pretty much. Anybody have any thoughts about how leadership went last year?
I was here last year.
Yeah.
It went pretty good. I mean, the students are pretty much assigned to their units. I would do rounds twice, in the mornings and in the afternoons, to see how everything was going with their preceptors. They would share with me how their day was going, give them meds and stuff.
Anybody have any problems? Katie, how'd you do?
No, I thought it was great, and they loved it, I got so much out of it, because they take a full assignment to sign.
And that's the idea, is that we really want to see them stretch themselves. Like if they're on a regular unit, by the end of clinical, they should be able to manage 5 patients. If they're on a step down, 4 patients, critical care, 2 patients, for site, then is 1 patient. So I just want them to be comfortable. But so really push them, and I will talk to them about setting goals that are appropriate, not just like they do. And I want them to take it from that like task dimension, like I want to give you injection, we'll see when you start IV, thinking critically, and then prioritizing peace. And their journal should do that. I'm going to ask them to list their patients, and then, what was your priority for each patient? And then out of those 5 patients you care for, who was the priority patient? So have them starting to think like a nurse in that way. And they'll be reflecting on that, and hopefully they should be sharing it. So
it gives them a chance to really do
so again, figure out where you want to meet with them, drop them off, and then check on, like you're saying, Katie, did you have a routine you did?
not just from.
I went around and introduced each of them to the nurse educator, nurse manager, and then I would just, once I got to the end, it was like time to go back. I just start checking on them. And then I would give take a little break, work on some care plans, and then
time and students have been randomly assigned, we did a survey just to make sure that somebody that really didn't want to be in critical care wasn't there, someone that didn't want to be in P's or OB wasn't placed there, but beyond that, they were really randomly slotted in. We ran it by the med surg faculty, to make sure we wanted somebody with no great skills in ICU. Because especially after last year,
Christmas, they all just went over.
there's nothing worse than that, we had a couple people end up wanting to be in ICU that should have never been there.
Yeah, towards
Because I teach psych, I don't see them on so we're going to do survey with spots to make sure they do a lot of special.
In the spring, they either save them for the next holiday.
Okay, you know, make sure you guys, you know, let people know how to reach you, should they have to reach you. Anybody else, any other tips? Have you done
No, but I have
something
a
before?
question for you.
Yeah.
How do you handle if, so we have the leadership group, and they clearly have decided that they don't want to do any type of real bedside nursing, or they think they want to go on and just go get their master's degree, or go do this, or they're already thinking of their next career. And are we supposed to be fostering like that, or are we still making, like, we're bringing them back to say, we need to complete this, and this is what we're doing now, or how do we handle that one?
Good question. Because
Because I'm very used to Penn students that come in and say, I want to be a nurse, oncology nurse practitioner.
I know.
And I'm like, have you worked in oncology yet?
Yeah.
And they're like, that's what I want to be. And I'm like, you need to go to an oncology course and see if you can. Okay.
They're not like
All right. They just attack you, and they already know exactly what they're gonna be.
Yeah.
And they don't wanna bother with all this.
But I think that's great to have goals, but I think, yeah, actually, you need to learn how to be
They're different
here.
Yeah.
Yeah.
Okay.
Yeah, and you make it, and if you get some that have that little bit of an attitude, who knows, we have some of them, you know, but certainly not like, I taught at Penn, and it's like, I asked them, I gave them articles, I said, I don't get a chance to read this now.
They
So
critique
insulted
it? Yeah,
that I
or
would
they
even
probably
suggest.
critiqued it on you.
Yeah, so, yeah, our students are, but I really do want them to be able to be a nurse.
Yeah.
And
So that's, I
and bring
wonder,
it
that's
and
our
bring it
focus,
back
and bring it back to
revisit with,
the,
take an
yeah.
evaluation.
We gotta start somewhere, and it's where we're at now, and.
So what I'm gonna send you is I'm gonna send you my highlights about like your journal thing, because it's different. Last year they wrote a paper, they're not writing a paper. I want them to do journals, real time, what are they doing every week, what's their need, what do they learn from it, rather than writing a journal that they put out in a patient with some diagnosis and how, what the care should be, what it was. Some of them use the message to the hospital, the crappy nurses staff, and just those, it wasn't helpful. So I want them to talk about what are they doing, and I think what you need is journal.
Yeah, you can reply and you can say, but you can reply and then you can tell them to make it like a gutty picture and that.
So this is what I want to do, I'm calling it kind of a journal. First thing is, I want them to, what you say. Second thing is patients. Who are the patients, what's the diagnosis and age, what's their care needs, what interventions did you do, what meds are they on? They don't have to do med cards, what meds are they on? And, what's their priorities? So it's,
I think that's good. A more focused journal, because before they would write just
yeah, well, that's, I'm trying to,
Something that their other classmates was uncomfortable about, that you didn't know what the
So-
other students just read out the other unit, like, you know, I wanted so.
all right, so this is what I'm having them do. So their log should address, number one, I want them to set a goal for the day, patient care for each assigned patient, initials and age, diagnosis, meds. I want them to tell me at least the generic, because NCLEX is testing the generic
Oh, that makes sense, yeah.
dosage,
Well, just
frequency,
so that
and
you
why
know
are they
the
taking
snippets
them?
of, like, you know.
Care needs, out of those care needs, which is their priority need, any safety concerns related to their diagnosis, meds, or their condition, and then discharge planning. So I want them to focus with every patient, I want them to write a little snippet, I don't want them to write care plans or any of that, but summarize this stuff. Then, and if they have 5 patients, they should write on 5 patients, and then identify the priority patient, and why is that your priority patient? Time management, I want them to look a little bit about what tasks needed to be completed, what was your priority, how'd the day go, so just kind of revisit how they did on managing their time.
And you'll be sending this to us?
I'm gonna send
Oh,
it to
great.
you, and then, of course, I can't pull up the.
Go back to Word.
Do you know how to do it? I can't, why is it
Which one
so
are you
hard?
trying to get?
I'm trying to get to the very bottom of it.
Oh, just shoot the other one to the left if that's what you're looking for. Or is that the one you want?
Why is it?
Enable editing at the top.
maybe
Click
if I
on
do
that.
It's like spinning, like, I don't know what's wrong with this damn computer. And of course, I don't have it to read, but on the bottom, it goes through like the reflection. And basically, what I want them to do is reflect on how did they go, what's the best thing, the worst thing, what did you learn, how will you use it? And I want them then to bring in a little bit of leadership stuff, like are you seeing teamwork, are you seeing collaboration, are you seeing delegation? Yeah, oh, there was a little bit of it, so. Oh, for God's sakes, anyhow, it's a little reflection, because I want them to do some, and back to your point, Kathy, on reflective process, because I think that's important, reflecting on, in and out, and then when you have a little bit of time, stepping back and looking at it. So that's the goal, and then at the end of clinical, they write a summary and sort of a synthesis of what did they learn, blah, blah, blah. That's it in terms of assignments.
Are they giving those to us or?
I'm gonna tell them to bring it in a notebook, 3-hole punch it. When you come, they should have it. If they don't have it, if they're not prepared, you can send me an email. I say send them home. I mean, if you came to work without a stethoscope and you weren't wearing your scrubs, you wouldn't be able to work. So, I mean, I know it sounds bitchy, but I think like, I'm gonna be clear about that. Like, this is the expectation.
Please do, so they don't be shocked and be like,
Yeah, I know.
That's what they said,
They need to be prepared, like, my mom was a nurse.
Well, that's the problem, that's part of the issue with the nurses working with, they don't have, they want them to come wanting to know things, not you're gonna tell me what I need to know now.
Exactly, and that's
That
the
just
piece of
makes
it,
it bad.
so they need to write goals based on who they are and what they need to learn. We may have some students that are fantastic at managing time and doing all that, then that's not your goal. Like, what's the issue? Maybe it's talking to patients, giving reports from Delaware, calling somebody else, working with another team member. So whatever it is, and I'll make the list of organizations as well, and I will really tell them, like, that's the thing. Because, like, I just want them to show up, because typically they do really well, and I got beautiful emails, like, from some people at PMC. Students came in the snow and like really like showed up, and like managers were really like, I was cool. Yeah, and I got, like, somebody said to me, PMC, I've never worked with a student that was this dedicated, and so, but they do a great job, and I appreciate the work you do with them, because they learn a lot. I really want them to learn a lot, and that's why, part of why I took the paper out too. That's one of the big about that. So hopefully this journal is as one of the somehow they have to put the network.
They'll focus on the clinical part of it instead of, let me make a good.
Yeah, and I want them to, in leadership, I really like a lot of books I'm using, I'm switching books, I used to use Porter O'Grady, which was phenomenal, but students complained about it. It was a little bit hard to grasp, because it's real abstract.
Which one is it?
Porter O'Grady, it was about
The
transformation.
latest one, the
Which was, I loved it, because it really cuts to that pieces, and I'm gonna try and pull in those concepts, but I really want them to think about transformational, leadership, it's a whole magnet stuff, when you work in the Magic Hospital, it's all about that, you're a leader, no matter what you're at, and that's the frame I
Whatever
want them
role
to
you're
think
in,
about.
yeah.
It's not about you're gonna be the nurse manager, it's gonna be how to be a leader.
Yeah.
Moving from that task focus, like I can give meds, I can do this, to acknowledge what we're like, thinking concepts through, prioritizing, seeing the big picture. So that's my hope, is they make that leap from, I could do all this stuff, and I'm gonna push them. So if you see goals that seem really tasky, step it up. Think about like, what is it you think you guys like to go being excellent, not just to give it to somebody. means a lot more, it's that thinking, like a nurse piece. So any other questions?
You'll send what book you're using to?
I will, it's the Kelly, I'm using Kelly Essentials, because we've used it in the past. It's a pretty straightforward book, but I'll send you that information. And they also have 3 different recommended textbooks that have questions in, on prioritization, delegation, so you can practice questions. So any feedback you have for me, anything you think would be helpful, anything I missed that I didn't cover, let me know. I will get student emails, and as soon as we can make sure, because we might have a couple students that are so we have a couple people out of the So as soon as things are finalized, by January, I'll send it. And apparently by January, you should be in Campus Cruiser, so you can click on your class and see everybody and see exactly. Anything else?
There's logs, do you want them handing them to us at the end of the day?
They should keep, no, they keep them, and when you come around, you should say like, show me your log, what you're working on. But they should be sharing it with the preceptors.
So they're just keeping one for each week, keeping track of it, and then signing off and checking off.
Exactly. So you might want to revisit like, okay, how to go with patients, tell me about how you prioritize, what did you do really well, and obviously we can talk about like what really went really well, what are you learning, what do you think now, what was your goal, did you need it, what's your new goal? We don't, usually have a lot of great things to say, especially at the magnitude facilities. But students have learned everywhere they go. If you have any questions though in terms of getting access to the training, what do they need to do for DuPont? I think they sent them names already.
I think they, there's also Delaware abuse clearance that has to go down.
Everybody's full.
I think that was pretty much it.
I know that some places that they needed to do a little more legwork was sent out.
Now, how many patients are they gonna be assigned now?
Well, the idea is that they work with the preceptor and, so, I don't know what the, what's the typical nurse?
I have no idea that pediatrics.
Sorry.
I would talk to her, what I would do is I would talk to the preceptor.
I'll look her up. See, nice talking to you.
Thank you. Thank you so much for today. You got it.
And how many patients do they have?
They just got here from the state and they took on her full time.
Yeah, because they're not like by themselves.
Right.
They have that preceptor and all work with, and I think the preceptor, when you say don't help them, and I would check too, I would need almost like.
I'll let everyone send
Anything I need to know, and if there's anything, well, like, you guys, like, please pass on to me, if it's safe, you should just, and honestly, shoot for that one crazy.
I sent something to her.
Most students do really well. I usually do good.
She said, I went in there, day one,
What time do you recommend and what does work out? Like what time should we start on Sundays? Like what should we say? Have them there at 6:30?
They should be there for shift, they should get report.
Be there by like 4 to 7?
Yeah, we definitely get them there so they're not like busting in and
Yeah.
give them a little bit of buffer time to like park, get themselves situated. And then, introduce them, because that first day they're gonna have to introduce themselves. Well, actually, yeah, probably on weekends, every day they're introducing themselves to the preceptor. So I would tell them, give themselves at least 15 minutes of like breathing, getting it together. Yeah. And then they should be reporting off. So they should follow that nurse. Anything, Jill, that you found was helpful?
Like last year I emailed them, so that comes back. They were like, who, what?
Well, yours was a whole.
I don't know, it was just like, last year was crazy,
Last
but,
year was incredibly crazy. No, and I'll tell you
and
what
I
else,
was like,
last year
there's
we
a
didn't
whole
have.
email chain, and it was, it's actually,
Yeah, last year we didn't have students placed nearly as early.
it helped.
Well, last year students weren't placed nearly as early, so that was part of the problem. Everybody's placed now, the only thing we have to do is. We were gonna bring her in anyway, yank them out. But we are notifying facilities, so that whole.
I have nothing to do with leadership, I said that.
Last year quagmire, no longer, should should not be a problem. If it is, let me know.
No, I don't know if
Okay, give me your number, hon, so then when you.
educator for their floor, we knew each other, so she was like, can't believe that, like taking it out on me, and I'm like, it's not me, like, it's not like I just picked a random person to show off the
So I think
floor.
there's a whole lot of, we've worked this course. But, and DuPont, I guess they were kind of back and forth about whether we could have students there or not. So if there's any sense that they're not
See, that was,
happy.
yeah, my impression of John was there's a lot of, service recovery that needs to be done.
And that's why I did this. That's why I'm all about communication. I put in there, our goal is to keep programs, all that fuzzy stuff, because I really want. And that's why I'm going to say,
Thank you so much. I'll bring next time. Yep, you got it. Thank you so much.
We get asked not to come back and show all of that. You can do it all. Are ignorant and expect. Thank you.
If I have any questions.
Yeah, please let me know. I'm gonna send you guys emails.
Thank you very
All the information. Thanks for coming in.
Okay, thank you.
Thanks, guys. Thank you so much. All right, nice meeting you. Thanks for everything.
Let me know. Carolyn, any questions, let me know.
Oh, thank you. Appreciate it immensely. Thanks for bringing in all your colleagues.
I don't really know how to do it, I was kind of.
If I had a referral program, I could try to help you out.
Figured it out, but
There you
I
go.
just read.
They didn't grant me that pilot.
They all, they were great budget.
Thank you.
But, they said, well, I don't think we have to do one. I said, oh, okay. What can I say?
Great semester, kiddo.
Yeah, it's funny, yeah, when mom's away.
I was just gonna see you because she actually, she emailed me, she's like, what shift do you want, what date do you want? I told her I would take 2, she's like, we'll revisit that in the fall, because I just.
With the full
Yeah.
You're gonna email me everything, right?
I will.
Okay, I appreciate it.
So let me pick first.
Which I was actually just,
I'm at CHOP, yes.
CHOP this morning to interview for a pool position.
Okay.
But then I almost like what I have there, like,
They'll be in campus.
I'm full-time St. Chris.
Okay.
Per diem at Shriners, at Drexel, school, teaching, like, that's why I'm almost like, no. I like what I have, but.
So then, can you repeat? So there's two different things going on now.
See you later.
Because he'll just check.
I know.
You've been there, you know that.
I put some
under your drawer.
You did?
I did. It's not money, it's college.
Yeah.
Right.
And I'm actually friends with a church who's in
Which, like,
Yale,
that didn't
and I
sound
think
critical care
she
to me.
was doing all weekend, and like,
Yeah, there's
I
little
don't
things
see
that
if
have like
we can
this.
do it, was so nice. That she's been there forever.
Lots.
Yeah, there was
Our
a
rapid response.
I was just
Now
over
it's,
there.
that's how they clarify. It's like the nurse you go to like 4
That's actually
like your
fit
foot.
me in
It's a
2005.
glorified foot.
2005? Yeah, I remember.
Thank you.
Thank you.
Thank you.
Thanks so much for a nice
Oh,
afternoon.
it was nice.
Thank you so much.